Good morning, Nitu. Thanks for joining me as we talk to leaders of Woodruff Health Sciences as well as Emory Healthcare. First, Nitu, tell us about yourself.
Absolutely, and thank you for the opportunity. It's a pleasure to be here in this profound setting. I'm a primary care physician by training, and I chanced upon an opportunity and ended up doing a clinical informatics fellowship, and that has been my career for the past almost 2 decades now. I serve as the Chief Health Informatics Officer here at Emory, a little shy of a year here, and that's my journey.
Yeah. Now, you had come from Yale, if I'm not mistaken.
You are absolutely correct.
What was it about Emory and Woodruff Health Sciences and Emory Healthcare that lured you here?
Very interesting question. I can think of the moment that I sort of decided, and it was because of meeting the people here. I felt that sense of energy and a drive to change and make things better, and I wanted to be a part of that journey.
Yeah, that's great, and we're so thankful again that you're here. So for the audience, help us to understand the office that you run. Maybe even just start off by defining what is informatics.
I get that question a lot. So informatics is a discipline fairly young, about 80 years to 100 years in the making, but it uses data, information, knowledge for the improvement of health and everything else that we do. It's taking healthcare principles, it's taking computer science and information science principles and behavioral economics and management principles to then drive change and blend technologies and clinical care in our world together. So we sit at that interface using technologies to enhance what we do in clinical care and not re-engineering what people do, but making technology fit better.
I mean, fascinating. And did we have a focus in that area when you came here?
Yes, there was a small presence in informatics before I arrived here. I think the vision when I joined was to ensure that it is firmly embedded in the way we think. And so we've been able to take that very small informatics presence into now an office of the health informatics officer where we have physicians and APPs and now pharmacists and public health personnel as well to help sort of frame what we do and get us ready for the mission that Emory is here for.
Yeah, you know, medicine historically is always last to the party because we're usually risk averse, and we would never put our patients at risk as well. This seems like an obvious step.
It is, but in talking with a lot of our clinicians, you have to understand the various moving parts and where technology can seamlessly blend in where it becomes a barrier.
My guess would be some people listening to this are going to ask the obvious question, which is, what does AI have to do with any of this?
I think it can help us take the grunge work out of work, and yet we will still need to do that high-level thinking, the emotional intelligence that we bring to the table, the shared decision making. For the clinicians, that's what brings medicine to humanity, so I don't see that going away.
You know, it's the case always as we look for efficiencies and precision and quality, we are seduced to adopting new technologies. And on the one hand, we have no choice. On the other hand, it potentially poses a risk for disconnecting caregivers from patients. And my hope and suspicion is that you're looking at ways of keeping the connectedness but still improving the efficiency. And so how do you view that sort of yin and the yang between we need it, we have no choice, but we still have to maintain our connectedness?
The shorter answer is with great responsibility. Part of it is that we need to ensure that any tool, technology, AI included, is integrated into how we think and not the other way around. And the other thing is that trust but verify. So we have the Office of the AI team that part of their responsibility is to do AI responsibly and monitor it. So if the models are changing, if it's hallucinating, how do you capture, how do you protect yourself from making sure that it's doing the right thing? And we have a great team of people who I'm sure dream about these kinds of things in making AI safe for us.
Well, I couldn't be more thankful for you to be here at Emory for joining the journey, as you said at the very beginning of this interview, of what we're on, which I'm excited about, you're excited about, the office that you've built and what you've actually brought to our patients. And so thank you for your leadership.
Thank you. It's been a pleasure.
Great.